It's time for our health segment, and joining us now is Africa 54 health correspondent Lino Mudu with the latest information on medical disparities. Hello, Lino.
Hello, Esther. The World Health Organization says there are wide disparities in the health status of different social groups in all countries, whether they are low, middle, or high income. The lower an individual's socioeconomic position, the higher the risk of poor health. The WHO says 87% of premature deaths due to non-communicable diseases occur in low and middle income countries. In the United States, one woman aims to reduce health disparities in her native country of Sierra Leone by helping to increase access to quality health care in a rural community. Joining me in the studio is Linda Moxon-Cissé, the CEO of the Community Health Foundation. Linda, thank you so much for joining us today.
Thank you so much, Ms.
Lino.
Miss Lino. Sorry, thank you so much.
Listen, health disparities is a very big problem, especially when you get in the rural area. There are places where there is no infrastructure at all, and it's something you have decided to tackle. First and foremost, when dealing with a community where there is nothing, what is the most important need where someone should start, where you started?
Thank you very much for this question. Growing up in Sierra Leone, I saw the desperate need to improve healthcare, especially on the maternal and child health. And considering the area where I came from is in the rural area, it's almost impossible to access quality healthcare. So it's the area where I came from, the only hospital that is close by is like 3 hours drive.
Oh, wow.
Yes, and through rough roads. Sometimes it's even impossible to cross. Like the vehicle gets stuck on the road.
Yeah.
Yeah. So when women are into labor, trying to give birth, sometimes they cannot give natural birth. They have to do like a C-section, meaning a cesarean section, to remove the baby when the woman is not able to give natural birth. So they have to take them to that hospital. The vehicle gets stuck on the road. They are not able to get there, and they die on the road. We lost the mother and the baby.
3 hours is a long time. So
yes.
Where did you start then when you saw the situation and it spoke to you growing up? Where did you start when you wanted to tackle that?
So when I came to US, I was fortunate enough to go to school and get my education in the healthcare. So I decided to form an organization called Community Health Foundation. It's a charity organization registered here in United States, Maryland, and also in Sierra Leone. I registered there also as a charity organization. So I started seeking for medical equipment and supply through, in this country, I started getting donations of ICU beds and medical supplies. I shipped them to Sierra Leone also as a donation to the Ministry of Health. So I started donating medical consumables in the country. That's how I started until 2022. That's last year. Yeah.
COVID and everything.
Exactly. So I established my own hospital with my team, together with my team. That is a maternal and child health hospital equipped with 30-bed capacity. Since then, with my partnership with the government of Sierra Leone through the Ministry of Health and Sanitation, they do provide doctors. Most of them are from Nigeria, and some in the country, and some medical practitioners.
So you followed a model. You started with a foundation, now you have a hospital, and one of the programs that you are implementing is helping lactating mothers and baby. This week is World Breastfeeding Week. What sort of needs does a mother who just gave birth and is breastfeeding need, and what are you addressing?
So because of, like I said, the lack of health care, so we are providing free health care to lactating mothers, pregnant women, and children who are under the age of 5. So thinking about the lactating mothers, it's really important that we're providing that health care to them, even that free health care, because most of them cannot afford to even buy prenatal vitamins because they don't have the money. So us giving them free health care even during pregnancy, and after the pregnancy, we continue with them, we follow up with them, we give them prenatal vitamins, we teach them how to breastfeed their baby, we teach them the importance of breastfeeding, because I mean it makes the baby healthy, and we give them like vitamins that will keep them healthy, and if one of them is like iron. It's very very important during the baby, and folic acid. It's very important for the baby's brain growth and all that. So we make sure that we provide that free healthcare to them because they are not able to provide. So it helps them continue to breastfeed.
So before we wrap, if someone wants to follow what you did, wants to help in fighting health disparities in the communities, what is your advice? Where should they start?
It's a good question. Yeah, it's always good to help humanity. Like I started my own through the non-profit foundation, and I also encourage them to do the same or partner with for us that are people who are already existing for like my organization. We are open to partnership. We encourage people who are coming in to partner with us so we can continue to do our work.
We have to leave it there, Linda. Thank you so much for joining us. That was Linda Maxon-Sese. She's the CEO of the Community Health Foundation. And that's our health report for today. Back to you, Esther.
Thank you, Lino, and thank you, viewers, for joining us today. We'll see you back on Wednesday.